Good morning all. Today on behalf of Department of Internal Medicine, I welcome you all to today's clinical meet. Today we'll be discussing an uncommon complication of a common tropical infection. And without wasting any time, I request Major Akash to please start.
My patient was a 63-year-old male. He is a veteran air warrior, resident of Pune, Maharashtra. Informant was self and spouse, and reliability was fair. He presented to us with history of fever of 3 days duration, joint pain of 3 days duration, and rash of 1 day duration. Fever was high grade, intermittent, with a Tmax of 103.6 degrees Fahrenheit, associated with chills and body aches, and relieved with antipyretics. He also gives history of joint pain, which was acute in onset, bilateral, symmetrical, involved both large and small joints, and was associated with swelling. There was no redness. He also gave history of early morning stiffness, which lasted for about 30 minutes. There was history of rash along with the fever of 1 day duration. The rash was non-pruritic, erythematous, macular, involving his palms and soles.
Dermat resident. Dermat resident. Please define macules.
Macular flat lesions, sir, which measure less than 1 centimeters in breadth.
Papules.
Papules are raised lesions less than 1 centimeter.
Any other resident? Dermat resident. Plaques.
Raised skin lesion measuring more than 5 centimeter. More than 0.5 centimeter.
Okay. Nodules.
Nodules are the raised skin lesion, which is less than 0.5.
With rounded configuration. Any other dermat resident? Okay. Continue. Vesicles.
Vesicles are the fluid-filled skin lesion measuring less than 0.5 centimeter.
mm.
0.5 centimeter.
0.5. Bulle.
Bulle are the fluid-filled skin lesion measuring more than 0.5 centimeter.
Pustules.
Pustules are the skin lesion containing the pus, which is not a clear fluid.
Non-palpable purpura.
Sorry?
Non-palpable purpura.
No.
Second last. Last.
Non-palpable purpura, sir.
They'll
be palpable purpuras. They'll have certain features like they'll be erythematous borders and they'll be indurated. They usually signify vasculitic etiology, and non-palpable will be basically because of other etiologies like non-inflammatory causes of purpura, sir.
Like, give one example.
It can be because of vasculopathy, sir, like any thrombotic conditions.
Non-palpable purpura.
Rash, dengue.
Great, thank you. Sit. Dermat resident. Name that.
So this is diascopy. Basically, we are trying to see any erythematous rash to rule out whether to see if it's blanchable or not blanchable.
Please sit. Medical cadets. No. First year. Mehak. Please define fever.
So a fever is defined as oral temperature which is greater than 99.9 degree Fahrenheit.
Which temperature?
Oral, sir.
So it is core body temperature.
Yes, sir.
Sit. Nursing officer. Okay, nursing cadet. Please stand. First row. First student. Sites to record temperature.
Sir, orally via rectal or axilla.
Okay. Any other? Nursing officer, please take on the question. Nursing officer.
Through tympanic membrane.
Okay.
Axillary, oral, rectal, pharyngeal, sir.
Okay. Please. So it can be central and peripheral, esophageal, right atrium, pulmonary artery, urinary bladder, and rectal. In the peripheral, it can be tympanic membrane, infrared, temporal artery, oral, and axillary. So next, ST. Ideal site. Most ideal site.
Which ideal site is the rectal?
No. Next. Out of these, you have to tell out of these. Yes.
Sir, esophageal, sir.
Okay. So it is right atrium. Right atrium, from where which receives the blood from all parts of the body, is the ideal site for core body temperature. Out of the peripheral, which is the ideal site? Next, Ashok. Most ideal site from peripheral.
Sir, peripheral is oral.
So it is tympanic membrane. Tympanic membranes of two types, adjusted and unadjusted. Adjusted type is the most ideal, and the most inaccurate out of the peripheral. Out of these peripheral, most inaccurate? Infrared, correct. Which is used mainly during pandemic and the one that is used at the airport. Next, Hemant. Rectal more than oral by temperature difference.
0.3 to 0.5 degrees centigrade.
0.4 degrees Celsius, 0.7. Next, rectal more than tympanic by?
0.5, sir.
So it is 0.8 degrees Celsius or 1.4 degrees Fahrenheit. So next, can you tell, is the rectal temperature equivalent to the core, means the ideal temperature, equivalent or more or less?
More or equal.
Molar, it is more than temperature, more than the ideal temperature. That is the pulmonary artery or the right atrial temperature.
There was no history of any altered sensorium, headache, or vomiting. No history of any preceding cough, sore throat, wheeze, chest pain, or breathlessness. No history of any palpitations or syncope. No history of nausea, vomiting, pain abdomen, diarrhea, or jaundice. There was no history of eye pain, redness, blurring of vision, nasal stuffiness, ear discharge, or tinnitus. No history of dysuria, hematuria, lower urinary tract symptoms, high-risk sexual behavior. There was no history suggestive of recent travel, weight loss, cough, hemopsis, or night sweats. He is a known case of primary hypertension for past 5 years, which is well controlled. There was no history of diabetes, tuberculosis, or coronary artery diseases. There was no history of any prior hospital admissions. My patient is married and he has 2 children. He consumes mixed diet. He is a reformed cigarette smoker who quit in 2017 with a prior pack history of 40 years. He consumes alcohol 60 grams per week for last 35 years. He denies any high-risk sexual behavior and has normal bowel and bladder habits. There was no history of similar complaints in the family.
IT, Srinu, summary.
A 63 years old male presented with complaints of chronic alcoholic, sir, and presented with complaints of fever and joint pains for 3 days and with history of rash for 1 day. And there is no localizing.
Please sit.
Sir.
Causes of infective polyarthritis. Next, Ram.
Sir, post infection can be any viral infection can cause, like chikungunya, dengue can cause polyarthritis. Sir. And
Any other? Do you want to classify infective?
it can be viral, bacterial, sir.
So it can be invasive joint infections or it can be reactive arthritis. Okay, infections without any joint invasion. So invasive, as you told, can be viral or bacterial. Reactive can be sexually acquired, chlamydia, ureaplasma, or enterocolitis, Campylobacter, Salmonella, Shigella, and others, infective endocarditis, rheumatic fever. So the non-infective causes of polyarthritis. Next. Non-infective cause. Go on.
Rheumatoid disease, arthritis, rheumatoid arthritis.
Next.
Psoriatic arthritis. Osteoarthritis.
Okay. Chandrasekhar.
Sir, non-infective causes are like psoriatic arthritis, rheumatoid arthritis, osteoarthritis, gout, and SLE, sir. Vasculitis.
Sit. It can be autoimmune in the form of rheumatoid arthritis, psoriatic, as told, SLE, Sjogren's, systemic vasculitis. It can be drug-induced, like antimicrobials, anti-DPP4, immune checkpoint inhibitors, chemotherapy, and psychotropic drugs. Then it can be also malignancy-induced. Solid tumors and hematological malignancies. Centripetal rash causes. Dermat resident.
Centripetal rash, we can think of infective conditions such as chicken pox, sir. Then even certain dermatosis in the pregnancy, they'll present around the umbilical area. And even a certain drug rash like dress, it starts from the face and trunk first. So that we can consider in centripetal. Most of the drug-related causes and infective causes usually are more peripheral compared to centripetal.
Chickenpox is not centripetal rash.
It starts from the trunk, sir, and then it
That is a
goes
centripetal
peripheral.
rash.
Yes, sir. So
Okay, ST. M4. Centripetal rash causes.
Sorry, chicken pox, dengue, sir. Dengue, chikungunya.
Sit.
Virus.
So it can be meningococcemia, RMSF, secondary syphilis, chikungunya, hand, foot, mouth disease, rat bite fever, subacute bacterial endocarditis, and erythema multiforme. So what are the possibilities? Hassan.
So at this stage, I'd like to consider tropical fevers such as dengue, malaria, and chikungunya also could be possibilities. These are most commonly encountered fevers.
Any other?
There could be inflammatory causes as well, sir. We can consider autoimmune diseases, but right now with history, I'm not leaning towards that.
So infective causes. You tell us the infective causes. Other than chikungunya, dengue.
Scrub typhus also could be there.
Okay.
Fevers could be there, but with no history of jaundice, I would not consider leptospira. And
Hemant.
So Lyme's disease.
Lyme. Because
unlikely, sir, because the given short
unlikely.
duration and no other
Tell the likely.
drugs.
Okay, sit. The possibilities can be tropical in the form of chikungunya, Zika, and dengue. Chikungunya and Zika present almost the same presentation. Herpes, Hep B, Parvo, and EBV are one of the few of the common causes of fever with polyarthritis and rash. Not so common in India, but very common in West. EBV and HIV and COVID.
His general examination revealed he had a height of 172 centimeter with a weight of 65 kg, a BMI of 22 kilogram per meter square. He was febrile with a temperature of 103.2 degrees Fahrenheit. He had tachycardia with a pulse of 104 per minute, which was regular. His respiratory rate was normal with a breaths of 16 beats per minute. His blood pressure was 124 by 82 millimeters of mercury, right arm supine, with postural hypotension. There was no pallor, icterus, clubbing, cyanosis, lymphadenopathy, or pleuritic edema. There was a blanchable erythematous rash present over his palms, soles, trunk, limbs, sparing the oral cavity. There was no peripheral stigmata of TB or HIV.
JT. Next. Next to you, Mehak. Major Gautam. Major Ayush. What do you mean by postural hypotension?
Sir, a systolic drop of 20 millimeter of Hg and a diastolic drop of 10 millimeter of Hg after a minute of standing.
After?
3 minutes of standing.
Good.
And pulse tachycardia, increase in pulse of 30.
Increase in pulse of?
30 per minute.
30. Very good. Please sit. So it is or either 20 fall in SBP or 10 fall in DBP with increase in pulse of 30. So IT, Kranti. Which one is orthostatic hypertension out of these?